Hello and welcome to this live and interactive web TV show. I'm Georgina Burnett. Now, every year an estimated 150,000 people in the UK have a stroke. That's one person every 5 minutes. Often strokes are associated with older people, but actually anyone can have a stroke, including children and babies. Joining me today to tell us a bit more about ways to prevent strokes, as well as what signs to look out for and ways we can care for sufferers, are Judy Walker from Life After Stroke Services at the Stroke Association, Dr. Shane Roche, consultant physician at the BMI Clementine Churchill Hospital, and Bob Baillie, a man who suffered a stroke at the age of just 39 years old. So welcome to you all. Now, we are live today, so if you have any questions for our panel, please use the box on your screen and we'll do our best to tackle them over the course of the next 20 minutes or so. First of all, Shane, what exactly is a stroke?
A stroke happens when the blood supply to the brain or part of the brain is affected and reduced, and that leads to lack of oxygen and other nutrients that are in the blood. And this leads to cell death and damage to the brain. And it's an acute event, so it happens quite quickly. And it's essentially lack of oxygen to a part of the brain or large areas of the brain.
So what factors increase your risk of having one?
There are a number. Age is an obvious one. The older you get, the more at risk you are. Also things like diet, high cholesterol, lack of exercise, but one of the most important ones, of course, is high blood pressure. So the one thing that we can't control age, obviously, we are going to get older, but we can control blood pressure. So blood pressure control is very important if you have a history of high blood pressure. Smoking is a risk factor. There's lots of risk factors, but probably the two most common are age and high blood pressure.
So on the subject of lifestyle, Judy, what can people do? What sort of lifestyle changes can help to reduce the risk?
Well, I think as Shane was saying, I think it's being aware of those risk factors, so being aware of blood pressure, making sure that it's checked regularly by one's GP. And the risk factors that one can address will be trying to reduce or cut down alcohol intake, cutting down or stopping smoking, exercise, taking regular routine exercise as part of daily life, and ensuring that one is taking one's health seriously.
So lifestyle aside, what sort of people are most at risk, would you say? I mean, is it hereditary?
I can't answer that question. I think that's probably a question for Shane. Really.
Not necessarily hereditary. I mean, there are very rare forms of strokes caused by hereditary disease, but I'd say more importantly would be other diseases that may be hereditary, like coronary artery disease, heart disease, high cholesterol, high blood pressure. So they would increase the risk factors for stroke, but not necessarily hereditary stroke.
So Bob, let's hear your story. First of all, what sort of lifestyle did you have before your stroke?
I was a motorcycle instructor. I was living on my own, sort of like get on with it, working, and then it sort of, I suffered. I felt I was getting a cold and generally unwell. A stroke at the time never reported to me because being so young, I didn't think I was having a stroke because I knew nothing about a stroke. It felt unwell. It built up over a couple of days. And I got a headache, and this headache was getting worse, as if like someone's pointing out there was an exit in my head somewhere. And by the Monday morning, all I wanted to do was go to work that day because being a motorcycle, even though I was unwell, I still had sort of customers to deal with. Anyway. I felt, as I say, I felt unwell, and I was getting worse and worse. But throughout today, I managed to go to work and sort of carry on the lessons, whatever. But at the end of the day, all I wanted to do was get home, fall asleep on the sofa, and then wake up next day, hopefully sort of gone or much better, whatever. When I woke up that morning, I couldn't speak, I couldn't swallow. I couldn't move my right side. I couldn't do nothing like that. It's only because next door neighbour coming, because they knew I had to go to work. When they tried to put aspirin and water inside my mouth, it just come running out, so they knew there was something wrong. Then they rushed me to hospital through ambulance. I knew what was going on, but to describe it, it's like being in a dream that you can't do nothing about. When I got to the hospital, I'd done various tests. I couldn't tell you what they were as such because I can't remember as such. But it's not until I was on the trolley and the doctor came out and said, "You've had a stroke." It was shocked to me. It was shocked to my family. But what they didn't tell me, they told my sisters that I had 24 hours to either pull through or pass away.
Oh goodness.
And they put me in isolation for a couple of days and then into a ward. But that ward, where the stroke ward is like today would do, it was like a medical ward. I felt I was the only one on there that had stroke, and everything had changed my environment straight away. And I was sort of docile because I can remember when I was sort of just sitting up, they got me to sit up, the room was spinning. And then as that time went on, they got me out of bed. But when I first got out of bed, what was 4 foot from the bed felt like 20 stories. Right. And even today, I'm very reluctant of height. So they got me out of bed and very slowly, throughout the couple of months, they got me out of bed, and very sort of, you make progress little by little, step by step. And I eventually, and I remember I had a nurse one side and a nurse one side, and your legs, it's like teaching a child to walk, speak, everything. And that's why, basically, when you have a stroke, it can affect you as if it's like teaching a child to say walk, eat, speak, whatever. And it's very frustrating because people see the physical side, but they never see the psychological side. And that's what hits you most, because if you feel good, if you got exercises to do or something like that, if you feel good, it's easier to do as such. You feel good at doing it, you feel better. And so really, we've got to put that positive back into that person as soon as we can. And they got me to walk, and as I say, like one nurse one side, one nurse the other. I said, right, I'm ex-army, let's go on with it. And from that day, I've never looked back. And for me personally, I think it was the army training that really got into me and really pulled me through. And I wouldn't say I'm perfect now, but I've still left with me. I can't feel my right side, even though I can move it. I can't feel the inside, and I have to sort of tell me right arm to move, or sort of if it's natural and I'm not aware of it, it sort of goes inside like that. So I was right-handed, so I had to change everything over to my left hand, i.e. like shaving or something like that. It's difficult, and that's where the child bit is, like you have to learn again, step by step, hour by hour, or day by day, and that's where the frustration comes in, and that's why a lot of people can't really sort of take a stroke in as such, you know, they lost their environment.
Especially when happening to you at such a young age as well. I mean, a real shock.
Well, it was because, as I say, I was too old to start again. That's what I felt like. I was too old to start again, but too young to retire. So, in a way, what do you do? You know, I mean, I'm sort of where I can't feel my right side. I've got short-term memory loss. That's why I had to repeat myself, because what happens is a lot of time I'm talking, we may have a laugh or something, and I knew we were talking about a subject, but I lose the track of like memory, you know, and certain words I'm sort of talking, I think, well, You know, I can't remember that word. Might be an easy word, might be, but give me another half hour or what. I'll think of that word, no problem.
So we'll talk about support, because obviously that's crucial in anyone that's suffered. But obviously you were lucky that you got taken to hospital in time. So signs are really important, aren't they? Shane, can you talk us through the signs, that sort of the FAST checklist?
Okay. I mean, FAST is a fantastic innovation. It's increased public awareness. The F stands for facial drooping, or loss of symmetry of the face. This groove in the face goes flat. The A is for arm weakness, so weakness of the arm or weakness of the leg on one side usually. And speech, as the S, can be affected depending on which side of the brain. Either you lose speech, as you did, or if it's in the right hand non-dominant side of the brain, your speech might be slurred. And then T is for time. The quicker you can spot the signs, get the patient into hospital, then the treatment starts. And it's about, you know, thrombolysis, blood clot busting drugs. So within sort of 3 hours preferably, and depending on the patient and their comorbidities as to whether they can have the drugs.
So how crucial is it that people spot these signs?
It is crucial, because the earlier you can get patients in for possible clot busting treatment, the better. And we're lucky now, because we have these hyperacute stroke units all around the country where patients can get to very quickly proper stroke units, early diagnosis, immediate scans. Bob's stroke was a hemorrhage, whereas the average stroke is where the blood vessels become clogged. So the quicker you get the scans and the quicker they get treatment. Not all patients can have treatment because of time, which is vital. So making the diagnosis early is the most important thing for the patient.
Right, so we are live and interactive. We've got quite a few questions in actually. So let's go with Norma Henderson first of all. She says, according to my son, who is an osteopath, holding a pack of peas on the head of a patient who's just had a stroke helps them to recover more quickly, or you could use ice cubes. So is that true?
I don't think it would be, well, it may be anecdotally, but I don't think scientifically.
Right.
I'm not sure what putting ice, don't know, not sure.
So really get them to a hospital is
I don't
crucial.
think, it's not going to do any harm, but I can't scientifically think how it would do any good.
Okay.
Unless it lowers blood pressure or whatever. I don't know, I can't.
Right, okay.
I don't think so.
John Nolan says lots of adverts in the press regarding body scans which could spot potential problems, one of them being a stroke. Are they genuine?
You mean preventative, I suppose, doing scans?
I guess that's what he means.
Yeah, I think it depends. I mean, if you've had a history of a TIA, which is a transient ischemic event, like a transient stroke, which typically lasts less than 24 hours, then you would be scanned your head and your neck and your heart. So if you're talking about body scans, I would probably think of heart scans, like an echocardiogram, looking for abnormalities of the heart, because the causes of stroke are either due to blockage of the blood vessel or a clot from somewhere else to the brain, typically from the neck arteries or from the heart. So you might want to scan the heart, you might want to scan the neck if there's a history of previous stroke or TIA, but we don't routinely do that. We don't go looking for it. And you may say, well, why don't we? Because it would be cost would be huge, you know, time consuming.
Okay.
But we do it if there's any hint that a patient has had a previous TIA or stroke type event.
Question possibly for Judy here from Christine Ellis. Having worked with the Stroke Association for 13 years after my husband died from a stroke, it's good to know that people are at long last realising the disastrous disabilities caused by stroke. Can you emphasise the need to have BP checks taken, especially in younger people?
Yes, I think the most significant thing that people can do is to get their blood pressure regularly checked. I think, as Shane was saying, it's a key indicator if you have high blood pressure. We would support that. We would also support the scanning for atrial fibrillation, which is easily detectable, but also for the reasons that Shane was saying, can cause problems which can lead to stroke. So yes, absolutely happy to support that. Would suggest whenever one sees one's GP to just routinely ask for the blood pressure to be checked if at all possible.
Okay.
Atrial fibrillation is a very important cause of stroke, increases the incidence about 5 times, and there are treatments for atrial fibrillation with new thinning blood agents coming out all the time, so it is a very important cause of stroke to look for. It's quite easily found, but it's part of a routine assessment if somebody's had an event.
And even at a young age, I think that was the point that Christine was saying.
Yeah, younger people with
as
atrial
well.
fibrillation.
Yeah, because that was news to me. I didn't realise, you know, at 39, such a young age to have a stroke there. And
well, yeah, it's because it's a frustration of the stroke. Your environment change. It's a matter of getting used to it and time, and you slow down.
Yeah.
Trouble is, I can't rush. I can't think rushing, because if I do rush, that's why I get mixed up with like words, or I can't think. If I sort of slow myself down, then I come across better. And it's like a person tries to speak again. If they try and rush, the person that can, you know, misinterpret or difficult trying to understand them, if they, you know, you can learn more just by slow it down a bit and then carry on. So I've learned that sort of in myself, and it's self-management. Yeah, self-management, if you like. So, you know, it's how can I say? It's right across. You know, it's right across what your whole life is. Slow it down and changed, and that's the one thing you've got to get not sorted out, but change for yourself, like change, you know,
used to.
Thinking positive again. So, you know, because it is a very negative thing. So we've got to put the positive there, and that's why when I talk to people about stroke, is making them understand that there is life after stroke. You know, you can pick yourself up again. You can do, i.e., go back to work again, retrain again. And that's why I like to there is life after stroke. You know.
A great advocate for that, and you're obviously doing very well. What could have been different if Bob and maybe the people around him hadn't reacted so quickly to symptoms?
I think Bob's was a little bit different because you had a hemorrhage, but if it's a clotting problem, the quicker you can get to an acute hyperacute stroke unit, then the chances are you will get these drugs to break up the clot, and that would prevent further damage to the brain. And as we talk about disabilities like weakness and speech and swallowing and all those things that go with a stroke, so that's important. It's about time, but unfortunately it doesn't happen a lot. A lot of patients fall through the net because they're not seen in time or not diagnosed in time. But I think the fast awareness has definitely increased, you know, the amount of patients who are diagnosed earlier and straight into hospital. And even if it's a false dawn, at least, you know, people are aware.
Well, let's hope that continues. Now, obviously, Bob has got a fantastic attitude to this. Support is crucial, isn't it? What can friends and family do for sufferers?
I think support is absolutely crucial, as you say. I think the emotional impact of stroke is something that hits the stroke survivor. We were talking before we came on air about the fact that many people think that when they come home, and that's obviously when the family become the carers, that life will sort of resume, they'll sort of click back to how they were before the stroke occurs. But for many people, there is the shock of learning that actually that's not going to happen. And they've quite often a feeling that once they've left hospital, all the help that was there in terms of therapies and so on, and the medical care that is there, is then suddenly not available. So I think for families and for carers to try and ensure that the discharge, all of the things are in place before somebody comes home, so that if there was a need for speech therapy, for example, that trying to ensure that if it's still needed, is available to the stroke survivor, that their relative, their loved one, when they get home. Sometimes it takes a while for all of these things to sort of be clicked into place, and maybe the role of the carer in that case is to ensure that the GP is thoroughly au fait with what has happened and is there as a resource and a support for them and their loved ones.
So Bob, it's been 8 years since you had your stroke?
Yeah, 8.5 years.
Right, so what has the support been like for you, around you?
At first, because there is a care package that was put in place, but because when you're in the hospital, obviously you're getting care, like the OTs come around, you do this, do that. And what you sort of learn to lose, when you leave hospital, all that, not stops, but, you know, because it's you start to lose it, and that's why I think some people can't be bothered, and sort of, you know, and I hate people to say I can't be bothered, because I say, well, if I can't be bothered, I won't be alive today. So getting to sort of picking themselves up, and I think that's more in a way more important to sort of, the more you can do, the better you are. Because if I need help, I'll ask for it. But some people just rely on help.
So great to have that ownership.
Yeah, yeah.
We've got loads of questions, so let's try and get through them all. So Jill Cook says, I would like to know if my risk of stroke is higher, if the risk of stroke is higher for me as my father had a stroke. Am I high risk as I am overweight as well?
Overweight is a risk factor, but you're not necessarily at risk because your dad had a stroke. Okay. It may well be that he had a history of heart disease or high cholesterol, or I don't know the circumstances, but it doesn't put you at increased risk. Unless, as I said, that there was a history of high blood pressure or whatever in the family. So I think, yes, exercise, lose weight, get your cholesterol checked, make sure your blood pressure is okay. They're the things that are most important as
the general
prevention.
Healthy lifestyle things, really, for anything. Pauline Devine says, is a person with aortic stenosis more likely to have a stroke? Is a person with this condition and awaiting surgery more prone to strokes? And do you have any tips for prevention?
Aortic stenosis, if you're awaiting surgery, it's obviously moderate to severe. I don't know the age, but yes, surgery now is very successful. You're only at risk of stroke because of probably a low blood pressure, you know, because the blood pressure tends to be low because there's a lack of blood flowing through that valve straight up to the brain. I don't think you're at risk prior to surgery, but certainly if you didn't have anything done, you would be at risk. And surgery is very successful.
That's good to hear. So Sheila says, my niece aged 45 had a stroke a year ago and lost the use of her right side and her speech. What is the rate of recovery of these areas in stroke victims so young? Judy, can you answer that?
I think it does depend on what the damage to the brain is, and also the kind of therapies and the intensity of therapies that are available to somebody. And I think also, as Bob is saying, trying to ensure that one takes all the opportunities and grasps them, to ensure that one is in receipt of the therapies for as long as is possible. Every stroke is different. Every stroke survivor's story is therefore different, and it's not easy to give a general answer to a question like that. Yeah.
But she's young, which is good.
Helpful. That's a good start.
And even after a year, you can continue to see progress. So I wouldn't give up after a year. You'd keep going, keep going.
Okay, yeah.
And she's got age on her side, you know, and she's more likely to.
Doesn't happen overnight, then.
Doesn't happen overnight, and you'll be amazed. I mean, as you, Bob knows.
Yeah. The secret is get yourself going.
Yeah, yeah.
You know what I mean? Someone will show you how to exercise, but it's up to you if you want to do it.
Yeah. It's all about the will.
It is, and I think you've got to look out for depression and post-stroke.
Right.
It's very common and should be treated.
I mean, I still have bad days where I feel depressed, because, as I say, let's go back, it is a very psychological thing, you know. I.e., I can't run for a bus or nothing, so I've learned to sort of, well, bus goes, I wait for the next one.
Right. Yeah.
So, you know, it's oh, sorry, I forget what I was.
Dealing with the frustrations.
Yeah, basically. That's right. Yeah, it's getting themselves going. It's looking on the positive side, and that's why I sort of, when I talk to people about stroke, it's sort of getting to realise what I forget. Yeah, it's right. It's gone. You know, to pick themselves up, to get things going. But a lot of people, as I say, a lot of people can show you, but it's up to you to get yourself going. And that's what we sort of, that's what I said earlier, that's what we've got to put into people as soon as we can. Some people are not ready, I know that. But as soon as they are, then yeah, let's get at it. Let's get exercise.
Yeah. And make the most of the support that is there.
Oh yeah.
Yes, I mean, a lot of our services, such as our support for people who have aphasia, which is a communication impairment, which about a third of stroke survivors may experience, is very much that is about trying to ensure that not only stroke survivors are helped with tactics and techniques to overcome the aphasia, but also to work with families and other people around the stroke survivor, so that they can do the practice, they can keep things going, the carers, the family members can understand what has happened and therefore what they can do to help. So it's working all around with somebody.
Yeah. And patience goes a long way as well with these things, isn't it? Steve says, could you comment on statins and whether statins can slow down any possible blood clots in the future?
Yeah, statins are interesting. We don't tend to start them immediately post-stroke. Some centres do. There is evidence to suggest that they do prevent or help prevent further strokes. They lower cholesterol, but you can have a normal cholesterol and still have a stroke. So there's some evidence to suggest that statins have a sort of an anti-inflammatory property, different property to them. So they are recommended, and everybody who's had a stroke, other than a hemorrhagic stroke, will be put on a statin.
Right, okay. So Bill Bedford says, does a diagnosed ectopic beat carry the same degree of increased risk of stroke as atrial fibrillation?
Very good question. I don't think it carries the same risk as atrial fibrillation. The answer is probably not. But we used to think that ectopic beats were nothing to worry about. We'd do a 24-hour heart tape and see ectopics and not worried about them. But now there is some evidence to suggest that maybe they are more relevant than we used to think. So I would say not compared to atrial fibrillation, but it's open to question whether we should be putting patients on blood thinning drugs if they have got ectopic beats. Right. It's very topical at the moment.
Okay. So Jeff Stafford, talking about the speed of response, an old work colleague of mine had a stroke just before Christmas and was taken into the local general hospital. His left side was affected, but he made quick progress, and within a couple of weeks he moved to the stroke rehabilitation hospital. Within a week he had another stroke and died. When he first had the stroke in the early hours of the morning and his wife immediately phoned for an ambulance, it took over half an hour to get there. Would this initial delay of treatment have contributed to his eventual death? What do you think?
Well, when you've had one stroke, unfortunately, you are at risk of having another, despite all the preventative measures we use. If he had a second stroke, the first stroke was obviously a small one and the second one was a much bigger one.
Right.
Half an hour, it depends on what time the total time was between the call or the stroke. I don't know if, did you say his wife found him or?
It seems like it was the early hours of the morning.
Yeah, you don't know whether, I don't know the timing of it.
Yeah,
I mean, we talk about 3 hours, maybe 4 hours.
Yeah.
You're talking about getting patients in early so that we can use these clot busting drugs, but there's quite a lot of contraindications, so I don't know the circumstances. But I suspect that the second stroke he had was probably so severe that he wouldn't have survived.
Right, yeah.
That wouldn't have made any difference.
Yeah.
Probably.
But obviously it is this fast reaction.
It's all about time.
Really important.
Time.
Christine Ellis said, no psychological support given after stroke. Why? I don't know whether she's saying that perhaps that's been her experience.
It is very common. We published at the Stroke Association a report a couple of weeks ago called Feeling Overwhelmed, where over 2,000 stroke survivors and carers were surveyed, and they talked about their experiences with psychological support post-stroke, and for many people it just does not exist. Right. If you had sort of say depression before stroke, the stroke won't get rid of the depression. No. And therefore if somebody has a mental illness before a stroke, it will probably still be there after the stroke. Then you've had the stroke. The main issues are, from the Stroke Association's viewpoint, that anybody who comes into contact with a stroke survivor is asking, checking out how they are, how their mood is, how are they coping, and that goes for the carer as well. there's much evidence from our survey which shows that the psychological impact of a stroke on a carer is felt for many, many years after the stroke, and sometimes up to 7 or 8 years beyond is not uncommon. And the reasons for that is because clearly a lot of attention is focused on the stroke survivor, but the carer is struggling to cope. So we would say all around the GP, as you were saying earlier, make the GP your friend and ensure that they check out, but all the other people who come into contact with stroke survivors, just take the time to check how somebody is coping, you know, post-stroke.
And what can help with that condition, situation, is understanding stroke more. You know, going to I'll give information talks where it's not what a stroke, you know, just what a stroke is what it's like, and understand a stroke. So if someone's caring for a stroke, you know, they understand why that person's like this, why they can't do that, why they get frustrated over this. So, you know, people that can't talk properly, you know, like through or have trouble communication skills, they can feel intimidated if they socialise with and don't socialise, so they stay in. You know what I mean? So, you know, it's signs that you got to look out for and you know understand it more.
So understanding is huge, isn't it, in the helping somebody to recover. Mr. Tucker said his wife had a stroke and he didn't really feel that there was much support available. Maybe it's just he wasn't aware of it. So what is out there? There
depends on where somebody lives, but the key to accessing a lot of support will be the GP. Clearly, Stroke Association, we provide a number of services. We have a helpline. If somebody contacts our helpline, which we can give you the details of after the programme, and that we can put people in touch with our services where they exist. Our services are commissioned by clinical commissioning groups and by social services. So where we have services, we are able to offer a lot of support. The key thing is to ensure that everybody is provided with access to information about the local support services, and our work is to ensure that that knowledge is shared around, that it's made available to GPs and to others within the community, and also that organisations that might not automatically think of themselves as having an impact, that they could support people with stroke. If somebody who is, say, a member of a club or a society wants to return to that, then sometimes we can provide volunteers that can help describe what the impact of the stroke is and help the stroke survivor become reintegrated and to go back to some of the pastimes and hobbies and things that they were experiencing before they had their stroke. And that's something that you know, we work with volunteers to ensure that that can happen.
Fantastic. Well, we're running out of time, so maybe just a final point from each of you. Shane, what's your final piece of advice?
Awareness, fast, control your blood pressure, watch your diet, exercise, all the usual healthy stuff, but they do count. And if there's any hint of an event, go and see your doctor, no matter if it's a false alarm, at least get it checked out.
And Bob, just briefly, what would you say to anybody out there who's maybe suffered a stroke?
It depends what you can do, what you can't do. Get some help, i.e. through reading the stroke line, or get someone to understand stroke a bit more, i.e. going on the website or reading a book or reading about it. Don't be scared to ask for help. You know, ask where your clubs are, take up a new hobby, feel good about yourself basically. You know, get that positiveness back into yourself and then start again, because when you have stroke it's like starting again as such.
Great message. Fantastic. And Judy, your final thought as well, advice?
I think a lot of the impact of stroke is hidden, and as we were saying before about the emotional impact of stroke, that everybody who comes across somebody who's had a stroke and their family, to check out how they're coping, and if they feel that something is amiss, to actually take action and not just leave it and think, oh, it will get better. It may not get better. It may get a little bit worse, and it will. There is certainly a lot of help around to support them.
Great advice there. Well, I've certainly learned a lot today. I'm afraid we've run out of time though, so my thanks goes to Judy Walker, to Dr. Shane Roche, and of course Bob Baillie for joining us. Now, if you'd like to continue with your questions and thoughts related to dealing with strokes, why not join your Benenden Health online community at secure.benenden.co.uk/suite/apps. Click on the Community tab to share and discuss with other Benenden Health members and find out more information about strokes with our fact sheet that will be available after the show. Thanks for watching and goodbye.